Welcome to the Ignorance Project. Thanks for joining us today. I'm really excited about having a friend from college. David is the Associate VP of Diversity, Equity, and Inclusion at OU Health. Okay. David, anything you want to say about yourself before we get started?
I'm just excited to be here. Really grateful to be on the Ignorance Project today. Shireen, it is amazing the work that you're doing in this space that I find myself in, working in diversity, equity, and inclusion. We need more people like you that have knowledge, that have connections, and that are willing to take their voice, although you don't work in this space professionally, but to get out there and to educate. And so I'm excited to be here, looking forward to dialogue and having a conversation. So let's
Me
go.
too. I'm excited about it. So when I found out, I had a conversation with you probably a couple months ago when the vaccines first started, and I found out that you were charged, being in the position that you're in, to reach out to the community about getting or being open to taking the vaccine, right? And I know we had a conversation about just the difficulty with that. And I want to pause there for a second because, people talk about why there's a lot of mistrust in the Black community specifically around anything healthcare related. And we always think about the Tuskegee experiments. I think that's the standard that people go to, like, yeah, there's a syphilis thing and, they injected people, blah, blah, blah. But there's a lot more. That's like one aspect of it, but there's a lot more to talk about when we talk about mistrust in the Black community, including just some people not necessarily having the resources to access healthcare like they should. Or, you see with Serena Williams and people not necessarily believing people of color when they're experiencing certain pain, and kind of really having to push for your own healthcare and advocate for yourself. But I also found this really interesting article that I hadn't heard of before. So I'm curious to see if you know about this from, I know, I'm putting you on the spot right now, from the Journal of Health for the Poor and Underserved. They were talking about how, of course, there's been a history of tests with the Black community. It's just that the Tuskegee experiment is what we hear the most. So in the 90s, there was actually research done with Black boys specifically, and trying to see if Black boys are more aggressive than their white counterparts. So they took these boys, they paid their parents, and they withheld their medications from them. They withheld water. They gave them a low protein diet. They administered this medicine that's going to make you a little bit more angry. And then that's what they're basing their research off of, to say that that Black boys are more aggressive. I don't know about you, but I know I get hangry pretty easily. So of course, if you're withholding certain things, you're gonna be angry. So it's normal. Is that something you've heard of before?
I have not read this particular study, but not a day goes by that I'm not baffled by some of the questions and some of the studies that are out there. So of course, during this time that everyone's talking about the Tuskegee Project, and I was actually surprised. I was in a meeting and a couple of my colleagues had never even heard of the Tuskegee Project, right here in Oklahoma.
Right.
And as I'm talking about it, in a Zoom meeting, like, you saw their eyes, just like they look traumatized. And so I'm thankful that they, in hearing the story, could be traumatized somewhat to it, coming from a different demographic.
Right.
But I was baffled that they were ignorant of the things that historically have happened in regards to our underserved and minority community. And so we talk a lot about the Tuskegee Project, but there's been so many other atrocious things that have happened over the course of time. So even after the Tuskegee Project, the government, our U.S. government, our wonderful country, was involved in the sterilization of women in Puerto Rico, also in some parts of Mexico and Southern California and Guatemala. Still to this day, African American females during childbirth die at a much higher rate than our white counterparts in labor and delivery. And so there's just so many things that happen that it's with good reason that the Black community does not trust healthcare systems.
Exactly.
And so one of the positives of 2020 and the Black Lives Movement is now people are actually open to talking about this, and people are acknowledging that there's a problem. And
Mhm.
so for me now being in this type of role, it's exciting because now it's not about sugarcoating things and trying to figure out the most strategic way to bring light on things. Like it's open, it's in the open, and we can just attack it straight on and figure out how can we support our communities that are most in need. And that's what I'm excited about.
Right. That's awesome. So I have a couple questions for you. The first is, in your personal experience, have you had any medical experiences where you felt like you weren't heard or given the care that you deserved?
Yeah, that's a great question. I think I was I'm 31 now, so I'm still young. But when I was about 24 years old, I went into the doctor, and I've been relatively fit most of my life, and very active in sports when I was younger, and for most of my life tried to live a plant-based diet. So at 24 years old, I go in to see my primary care physician, and my blood pressure was higher than normal. And so it was right there at like borderline pre-hypertension. And
Hmm.
immediately the physician at 24 years old wanted to put me on high blood pressure medication. And I was kind of like, whoa, doc, because he was a preventive medicine doc. And I'm like, hey, doc, you
Right.
preventive medicine,
Right.
like I'm 24 years old. Like, are there some other ways of, treating this?
Yeah.
And he was like, well, I've done a lot of research, and high blood pressure, it runs rampant in the African American community. And so I think it's best that we put you on this medication. And so I was like, doc, I appreciate, whatever research you've done, but I'm too young for medication to
Right
be my
now.
number one option. And so he was like, all right, so we'll set up a follow-up appointment. I can't remember if it's like 6 or 8 weeks. And he's like, go ahead and see if you can change your lifestyle. And then when you come back in here, we'll test. And then based on that, I'll prescribe or not prescribe. So immediately I cut out fast food out of my diet.
Mhm.
And I started exercising more regularly. And when I came in for the follow-up appointment, and I quote the doctor, he was like, "Oh, your blood pressure is perfect," but it was still with like a judgment, like, "Okay, now whatever you're doing, you need to keep it up because
Right.
if you get out of this range again, you're going to have to get on medication, and this runs in your community." And so now I can't speak for my friends that aren't coming from my demographic to see what their experience was from the physician, but this physician, from my opinion, didn't believe that I could change my lifestyle and improve my health.
Right.
It seemed as though he was very pro putting me on medication.
Mhm.
And so I'm thankful to be raised in an environment where I have been exposed to kind of a wholeness kind of lifestyle and other ways to control,
Right.
those things. And so that was my first experience where I was like, whoa, because if I hadn't have pushed on the doctor, I'd probably be on high blood pressure medication right now,
Hmm.
and then what kind of effects could that have had on me, over the last, 7 or 8 years.
You're right. That's interesting. Because I actually have a similar experience where my blood pressure runs pretty high. But recently I was actually at I'm telling all my business on this thing right now. But I was at my physician's office and it was scary high. And he sent me to the ER. And I went to the ER and they said, do you have a headache right now? I said, no. And of course, we're in COVID time, so take that into account. But still, it was high enough for him to say you need to go to the ER immediately, right? And after they asked me if I have a headache, they're like, well, you've been told to go on these pills before. We're going to give you these pills, but go home. And I came home and I really thought about it because then I started doing my own research and I've made my own lifestyle changes recently to try to mitigate that. However, just in that moment, it was high enough for him to be terrified and like send me to the ER immediately. Like, I should be calling you an ambulance right now.
Mhm.
And you sent me home. And would that be the same if I looked different? Would you have still sent me home in that moment? So even me as an educated person, with parents that have always been advocates for like pushing for your own health care. In that moment, I didn't even think about it. So I can imagine someone that doesn't even have the resources that I've had to date being in a situation like that. They wouldn't even go home and think about that, like, what else could I have done? What else could I have said? I should have pushed back on XYZ. So it's just a very difficult situation, and just having these conversations so that we can understand how we can continue to mitigate that in the future and also bring this awareness is really important. So
Absolutely.
thanks for sharing your story. Now I want to kind of pivot a little bit to talk about you actually moving forward with making the community more receptive to receiving these vaccines.
Absolutely. So, just to throw off a few stats, particularly for the Black community. Black folk are 1.4 times more likely to get COVID than a white person.
Mm-hmm.
Um, Black people are 3.7 times more likely to be hospitalized for COVID than a
Mm-hmm.
white person. Black people are 2.8 times more likely to die due to COVID related symptoms than our white counterparts, and that's coming from the CDC. And so it's crazy because Black people only make up 13%, 13.4% of the US population, but we're making up over 30% of the COVID cases in the US. And so disproportionately, this is affecting our community more than any other community.
Right.
And so when we're looking at that, and now, we've got two vaccines out there, Moderna and Pfizer, and then Johnson and Johnson just recently got FDA approval, and it's going to come out there soon. And so our community has a hesitancy of taking vaccine for good reason, because there's tons of examples of why there's distrust with the Black community. And so we had to really look at this from a hospital point of view, is that our goal is to provide for all lives around our hospital. And as our census is high, and for most of this pandemic, we've been 40-50% of our census has been COVID patients. So when we're looking at trying to really improve the lives around our health system, we've got to look at a special missional purpose to target the communities that are most affected. And so we put together a special outreach committee at the hospital that had diverse representation of people that worked in the hospitals to think about this problem. And so the first thing we thought about was, okay, well, how are we going to convince people
Right.
to take the vaccine? And then also, is it even our job to try to convince people to do something,
That's
right?
a good
Um,
point.
and so immediately you kind of jump into this crisis mode. You're seeing people die. We've got providers, physicians on the committee, and they're like, I'm seeing my patients die from this every day. We need to do everything we can to get people to take this vaccine. And so I kind of jumped in like, hey, what we don't need is a large organization, that is predominantly white, to then go to the Black community and tell them, this is what we need you to do. What we need to do is provide education so that people can make an informed decision about whether or not they should take the vaccine. Because, I'm a believer that if you give people the appropriate information, they'll be able to make the best decision for their
Right.
lives.
Right.
So that's what we started doing initially, was we started setting up Facebook Live sessions with community partners to just have a panel of diverse providers talking about what's going on, what's the data, what's happening, what's the background behind the vaccine. And that was very successful. We did it at a couple churches, a couple large Black churches in the Oklahoma City area. We also did it at a large Black church in Tulsa. And so, thousands of people tuned in and sent in questions live. And so that was our first phase, to provide education.
That's
The, sec-
amazing.
the second
Yeah,
phase,
yeah.
the second phase of that is like, okay, now when we look at the community, do they have access to actually getting the vaccine, right? So what we've seen in our populations here in the Metro Oklahoma City area is that there's a lot of people that want the vaccine, and how it works in most states. I'm speaking for Oklahoma, but in most states, it's the public health department from the government that is in charge of distribution of the vaccine. So they're getting the vaccine from the federal government or from whatever other relations they set up, and then they're dispersing the vaccine to hospitals, into pharmacies, based on need and availability.
Okay.
And so what they'll tell us is that we have X amount of vaccines that you can give to this particular group of people.
Okay.
So right now we're still in phase, or actually we just moved to phase two, which is starting to get in Oklahoma, getting the vaccines to teachers. But the first phase was 65 up population and those dealing with really, really traumatic health issues that they would need the vaccine.
Higher
And
risk
so the
conditions.
public health department gives us that and says, these are the people that you can give the vaccine to. And then we focus on how we can distribute that. So we got a COVID clinic every day in the hospital. We've got a beautiful children's hospital. We've got everything set up in the lobby, and it's just throughput is great. People are in and out in 15 or 20 minutes, getting the vaccine, getting out. But what we saw was that 90% of the people were white, and maybe about 10 to 15% were people of color that
Right.
came to the hospital. But then if I look at the data that I just spit off a few minutes ago, it's like, hey, the ones that need the vaccine the most, we're not seeing them coming through our hospital. So how do we reach that population? So I'm excited that we had a couple projects that got approved in bringing the vaccine to the community. So 3 weeks ago, we went out to Millwood School District, which is in Northeast Oklahoma, which is a predominantly African-American community. And so we had a vaccine clinic in the gymnasium of the local high school that's predominantly Black. And I would say 80% of the people that came through that clinic were Black. And it was exciting. And so some people came in with apprehension and they're looking at it and they're like, I was nervous about getting this vaccine. But then when I saw that the school was putting this clinic on, then I was like, oh, my kids went to the school, or my mom went to the school. Yeah. So I trust the school. They wouldn't be giving out something that would be bad for us. So they came in. But the other piece of that was access to getting signed up. That's the biggest complaint we hear is the public health department. They basically put up a website, a sign up list, and they'll be like, bam, we've got 10,000 more doses. And within 30 minutes, all the signups will be gone.
Yeah.
So within our communities, sometimes it's about knowledge. Or were they abreast of when that list dropped to sign up? Do they have access to high-speed internet? Do they know how to use a computer, use the internet to sign up? So what we did for these special outreach clinics is we got approval from the public health department to simplify the registration process. So instead of them going through the public health department's website, we just set up an easy sign-up genius.
Okay.
And it's name, date of birth, contact information.
Okay.
Bam. And then we didn't put it on the web. We didn't put it on the internet. We sent it through our community organizations that had access to these people that we wanted to get the vaccine.
Okay.
So that way we could make sure we're getting the vaccine to those that need it most.
So is that them like knocking door to door, sending it in the mail? What does that look like?
So for the school, they sent it out to a distribution list of emails and calling with people that were connected to the school. And then, once word of mouth gets, that thing just starts spreading. We just did actually, I don't know when this is going to air, but just yesterday, we did another vaccine clinic at a Black church in the north side of Oklahoma City. And so we worked through, it was 15 Black churches that came together to organize the clinic. And so we brought the vaccine to one of their churches. We had it in their fellowship hall. And so then they spread it. And I'm not even sure how they spread it, but they got out the word to all 15 of their churches. And then we were packed out and we got 250 doses delivered yesterday. And the people were so excited to see, the hospital actually cares enough to bring the vaccine to us. And then they just felt comfortable. I'm sitting there and I'm registering people and talking to people yesterday. And they're like, oh, I'm so glad that you're having it at this location. This is closer to my home. I go to this church, or I go to the other church, but my sister comes to this church. And so they still shared apprehension about the vaccine. And, we have to acknowledge that. And I was like, I completely understand. I'm just glad that you're here. And so they felt that it was a really trustworthy environment. And to help with that trust, we had all 15 bishops and the first ladies
Mm-hmm.
get the vaccine at the beginning
Oh,
of it. And so we got it on videotape. And
right.
so then the churches are going to, distribute that video footage of them getting the vaccine to say, hey, I'm a believer in this. I'm a believer in science.
Mm-hmm.
And we encourage all of you all to get the vaccine as well. And that was completely the church's idea.
Really?
Yeah, it wouldn't be a good idea for a health system to be like, hey, like, can we tokenize your bishops real quick and
Right.
put them on camera? But no, they were like, no, this is important. That
Yeah.
we need to speak for our church and we need to do it. So,
And people trust their pastors in our community, especially. There's a lot of trust in religion and pastors. So it's great to see that you're
absolutely,
able to do it there.
absolutely. And they want their churches open. So they're like, hey,
Yeah.
if this is going to get my church open, then let's get the vaccine out to as many people as possible. So,
Right, right. That's wow. I'm very impressed at like all the work that you've done to push something like this forward, and it's really going to make a huge difference in your community. My hope is like people watch this and they see it and they kind of get some new ideas about how they can continue to reach out to their community to make them feel more comfortable with the vaccine.
absolutely. And I would be remiss if I took that gracious a note that you give me. It's really a teamwork,
Right.
so a group of people on a committee, and I'm actually new to the city, so I don't really have too many connections.
Hmm.
But I'm real grateful to work with a team of people that are dedicated to this. And our pharmacists, our School of Pharmacy on the campus, they've for the last 8 weeks have basically been working 7 days a week.
Yeah.
They're coming out every day, putting on these clinics, and so I'm so grateful to them.
Yeah.
And we at the hospital, we say we're all in this together.
Hmm.
And we're just all doing our part, really to try to do what we can to shut down this pandemic and get back to some semblance of normal.
That'd be great. I can't wait to get there. Let me ask you, so is there like a theme of concerns that you hear from people? Because I know I've heard a lot of people say things like, I don't want to get the vaccine and get COVID because you're putting it in my body. Are you hearing things like that?
Oh, absolutely, absolutely. So the panel discussions have been really great.
Mm-hmm.
To have our physicians, our Black physicians, talking about it and answering people's questions. So there's been a lot of concerns. So one has to do with mRNA. What is mRNA and how is this affecting me? So the one misconception is that we are giving people COVID
Mm-hmm.
so that then their body can fight it. And so I don't want to jump into the science because I'll misspeak about that. But the truth of it is the vaccine does not have COVID in it.
Mm-hmm.
And so the vaccine is giving your body something so that it learns to fight against COVID.
Right.
And so that has to speak to the mRNA, DNA, the messenger DNA, and how that works. And so I encourage people to log on to the CDC website to learn more about the mRNA and the vaccine. So that's one concern. A lot of people have concerns about the side effects. If you've received the vaccine, you might have some pain on your arm around the site where you received the shot. And especially for the second vaccine, you might receive for 3 to 4 days flu-like symptoms coming from that, and so that scares people, rightfully so.
Right.
But so far, what we've seen for the majority of people, that those side effects go away within a few days. And people have been doing pretty well with the vaccine after that. At all of our clinics, we monitor patients for 15 minutes after they've received the
Mm-hmm.
vaccine. And so there's science around that. If something major was going to happen, it probably would happen immediately within the first 15 minutes. So we always make sure we have a nice waiting area with snacks and connect with the people there. And there are subgroups of people that it would not be helpful for them to receive the vaccine. So it's very important that you do some research about the vaccine and talk to your provider before you get it, especially if you're allergic to certain medications or you have any particular types of health issues. So those questions come up all the time. I'm on dialysis. Should I get the vaccine? I'm looking to have a baby soon, or I'm trying to get pregnant. Should I get the vaccine? And so I encourage all people to check with their providers if they have questions like that. But in those two examples that I just gave, some study just came out from the American Medical Association that is encouraging people on dialysis to get the vaccine, as well as there's been a study that come out that says that if you are pregnant, it's okay to get the vaccine. And so there was a big debate about that in the beginning, and at first providers were saying, we don't have enough information to recommend on this. So if you're worried about it, don't get it. But now they've gotten more data, and the American Medical Association is recommending that people in both of those demographics get the vaccine. But I would say if you're uncomfortable, to talk to your provider and then come up with a plan.
Yeah, and I know a lot of people say that too, like, oh, it's so new, we don't know everything yet. Should we really get it? But when we just look at the fact that we're in a pandemic, a global pandemic right now, and we are thankfully at a point where we know enough to know that it's safe, but we're still discovering certain minor things from what I've gathered. Okay, my last question for you.
Okay.
Do you plan on getting the vaccine, or have you gotten the vaccine?
Excellent question. I plan on getting the vaccine as soon as we get to stage 4, in which my younger demographic will be able to get the vaccine in Oklahoma City.
Right.
So I'm actually a little sad that I didn't get it yet, but I'm just going to wait for my time in line. So initially, when the vaccine came out, the first group of people were getting it were our medical professionals. First, we identified all of our frontline people that should get the vaccine in the hospital. And then as soon as they got it or declined to get it, then whatever vaccines we had left available, we allowed anybody that worked for our health system to get it. Unfortunately, this was like right around Christmas week. So, by the time I signed up, all the doses were gone. But I spent a lot of time talking to colleagues and friends about the vaccine. And when I started, I was on the fence, in all honesty. There was a couple of things that troubled me about the vaccine. One was that the vaccine has been approved for emergency use.
Right.
EUA, emergency use authorization from the FDA. And so what that means is if you say, oh, is it FDA approved? And someone says yes, that's a little misleading, because it hasn't been approved as a normal FDA approval process. It's been approved for emergency use because we're in a pandemic. And so I spent a lot of time studying what that actually means. So anytime you are going through the clinical trials for something to be approved for the FDA, there are 4 stages of clinical trials. And so for emergency use, they only go through 3 stages. And in particular, with these vaccines that came out with Pfizer and Moderna, one thing that was troubling for me is that they did phase 2 and 3 concurrently.
Okay.
So typically, you would have phase 1, then look at the data and say, oh, it's safe. And then you do phase 2, look at the data, oh, it's safe. And then you do phase 3. That makes sense. 1, 2, 3, 4. But because we're in such a dire need, they ran phase 1. They saw that, okay, this appears to be safe. And then so that they could get the vaccine to go out faster, they ran phase 2 and phase 3 at the same time. And so that was troublesome for me. But when I looked at it, this wasn't something that was just affecting one particular community. It was affecting the whole world. And our pharmaceutical companies were under a lot of pressure to deliver. So they stopped a lot of the other projects and put everything they could into this. And that's why they were able to develop the vaccine so fast. So that was my initial concern. But after I spoke to more people about that and realized why they did that and learned more about the efficacy of the vaccine and the data behind it, I became comfortable. And then the other piece was, well, what about phase 4? What is phase 4, and why isn't it going through that phase? Well, the phase 4 part is post phase 3, of course, but you can't do phase 4 because it takes like 12 months to go through phase 4. And so once they've deemed the vaccine safe, then they do a phase 4 to measure how it does over a longer period of time. And so that's the major difference between just being approved by the FDA and then being approved for emergency use. So for emergency use, it's like, we're going to do phase 1, 2, and 3, and then we're going to get it out to the people. For a regular approval process, they would have done 1, 2, or 3, and then they would have gotten a much larger sample size of people to go through it over a longer period of time, and then it would get the approval process. So that's the major difference there. But with the effectiveness of these vaccines, I would say in the next 24 months, they'll get the standard FDA approval. And then they're going to improve over time as well. So every year we come up with new flu vaccines. And I don't like to compare the flu to COVID because a lot of people have done that and there's been a lot of misconceptions out there. But each year there's new flu vaccines approved that are more effective than the year prior. And so I anticipate that that'll happen with COVID as well.
Yeah, I'm hopeful for that. Right now we're 95%, or Moderna and Pfizer are 95% effective, I believe. Johnson & Johnson, I don't remember the percentage for that one, but I know that one's coming soon. And even if it's lower, right now it's better than having nothing. It's still going to protect you to a certain extent. So.
Absolutely.
Yeah. All right. Well, David, thank you so much. I really appreciate you having this conversation with me. I think it's really going to be helpful and hopefully answer some of the misconceptions that people have about getting the vaccine. So thank you.
Oh, Shireen, it's a joy to be here today. Whenever you need me, I'm there. I've really enjoyed listening to your podcast and connecting with. I was connecting with Evan Willis the other day. I know you had him on the podcast, and he's really doing some amazing research in his doctoral studies. And so I'm really excited about this project. And so if anybody's listening, which I know there are people doing, I encourage you to check with your providers on the vaccine. We're all in this together. And also want to encourage you from a health perspective that, the vaccine can't be your only fight against COVID. We've all got to do our part to live healthy lives. And there's so many things that we can do to improve our health. Getting exercise, eating healthy, and other variables as well. But this is really affecting our communities just in a rampant way. And we've got to be intentional ourselves and committed to this fight ourselves. And so although the hospital systems are jumping in, it starts with us first. We've got to take care of our own, and then look for the additional support that we can get. But thanks for having me today, Shireen, and I look forward to connecting more in the future.
Of course. All right, guys. Thanks for listening.